Before April 2020, COVID-19 was not the world's leading infectious disease killer. It was tuberculosis. But when the pandemic gained ground, the focus shifted. All resources, money, healthcare workers, public and private hospitals were redirected towards containing COVID-19. The result? The WHO estimates as of March this year, an estimated 1.4 million fewer people received TB care in 2020. It's a reduction of 21%. This is predicted to cause an additional 500,000 TB deaths. Hi, my name is Anubha Bhonsle, and this evening we're talking about years of TB progress undone by the pandemic in India's context. This is Newsworthy, and not just on World Tuberculosis Day. We've collaborated with Partnerships for Impact for this series of videos on the many ways in which COVID-19 has impacted life and more. Some of you may know India has long borne the highest global burden of TB, 27% of the world's cases. So when the pandemic hit, India faced a severe blow. I'm going to list 5 ways in this video in which this happened. Number 1, fewer people reported new TB cases. There were mobility restrictions, and that meant it became tough for people with TB symptoms to seek medical care. There is a September 2020 study by the Global Coalition of TB Activists, and it found that 85% of healthcare workers found significant decrease in TB testing during lockdowns. Obvious, right? It became hard for healthcare workers to reach potential patients. Now, that is crucial because it's a crucial part of India's active case finding strategy. Patients were reluctant to go to hospitals for fear of COVID-19. All of this fall in detection of new cases means that the number of missing millions has likely increased. This increases the risk of spread of infection. Let's talk about existing TB cases. TB services were deprioritized and ongoing treatments were disrupted. Many hospitals that were previously offering TB care were now converted to COVID-19 only hospitals. TB testing machines were diverted to test samples of COVID-19. There was then the disruption to supply chains. It meant that medication began to run out. And then that fear that I mentioned slightly earlier in the video, 51% of TB patients who were surveyed in India said that they were less likely to seek care due to fear of COVID-19. Now, this was and is especially bad for multi-drug resistant and extensively drug resistant TB patients, where time adherence to the treatment is absolutely vital. Number 3 is TB prevention. That was also impacted. Staff shortages, especially ASHA and Anganwadi workers, being redirected meant that 1 million fewer children received their BCG shot in April of 2020. Now, all of this low reporting means there's less incoming data, which means funding gets cut. Last year, worldwide funding for TB was $6.5 billion. It's half of the target that was agreed upon by the UN Political Declaration on TB. This means qualitative and quantitative research on TB is hit. That study that I mentioned earlier recorded that 75% of TB researchers said that they do not have the necessary resources to do their work. I also want to set all of this in context because there's a larger arc to see this in. TB is seen as the poorer cousin among infectious diseases. It largely affects poorer people in the developing world. Despite killing more people than any other infectious disease in high-income countries until COVID-19 came along, TB remains largely out of sight and out of mind, which also explains, among other reasons, why global resources were diverted from TB to COVID-19. That's sort of a class-agnostic disease. It also explains, in part, why we don't have a TB vaccine beyond BCG, despite decades of research. But multiple vaccines have been developed for COVID-19 within a year or so.
Yes, TB is caused by a complex pathogen which co-evolved with humans for thousands of years, making it harder to make a vaccine. But it can't be denied that the dedicated pouring of money from governments, from corporations, and from global organizations into finding a cure for COVID-19 helped, something that hasn't been done for any other disease till now. It also doesn't help that the symptoms of the two diseases, TB and COVID-19, could be the same, and the stigma of infection is comparable. This makes contact tracing and case finding as essential as it is difficult. And as a result of all these factors, reporting of new TB cases in India decreased by about 25% in 2020. During April and May this year, India registered around 206,000 TB patients, which is a 53% decline from April and May 2019. Experts say that this will change India's plan to eliminate TB by 2025. In 2015, India set targets for the detection and treatment of TB cases every year to reach this 2025 goal. These targets were revised last year and India met the 2020 goal, which is good news. But the revised 2020 targets were considerably smaller than the original plan, which means that there's more work to be done between 2021 and 2025. It is not clear what the impact of COVID-19 will be on dedicated TB funding. India has usually fared well here. In 2019, India spent more on TB research than any other high TB burden country and more than other top spending nations. In 2020, India spent over 33 billion rupees for curtailing and eliminating TB, which is 2 billion rupees more than 2019. But money alone may not solve tuberculosis in a post-COVID-19 pandemic world. A new TB strategy will have to account for and possibly make use of increased awareness about wearing masks and washing hands, a heightened focus on public health, accounting for reduced incomes and undernutrition, and the uncertainty about whether or when COVID-19 will be controlled. That's where we'll stop today. I want to nudge you towards our YouTube channel. You can find it under the name Anubha Bhonsle. On it, we have a complete playlist with videos on the impact of COVID-19 on otherwise forgotten aspects in collaboration with Partnerships for Impact. My name is Pallavi Prasad, and if you have been listening, thank you for your time.